This is Mort Kern. I'm from the University of California at Irvine Medical Center in Orange, California. I'm here for the CVN Dynamic Editorial interview with Dr. Hong from the Chonam National University Research Institute of Medical Science in Gwangju, Korea. And I'm also here with Dr. Tim Fischel from Borges Medical Center in Kalamazoo, Michigan, who has assisted us with an editorial comment on this fine work. The title of Dr. Hong's paper is Incidence, Predictors, and Outcome of Plaque Prolapse After Stent Implantation in Patients with Acute Myocardial Infarction and Intravascular Ultrasound Analysis. And I think I'll just talk with Dr. Hong. Dr. Hong, I wonder if you could briefly summarize the paper and tell us what the significance of the finding is.
Yes. We used intravascular ultrasound to predict, to assess the incidence, predictors, and post-procedural outcome after stent implantation for impact-related arteries. The incidence of plaque prolapse was 27%, and pre-intervention IVUS characteristics like plaque rupture and positive remodeling and longer stent length predict plaque prolapse, and plaque prolapse is associated with myonecrosis after stent implantation.
Very good. So plaque prolapse appears to be associated with some adverse effects.
Yeah, we checked the 30-day stent thrombosis rate. Also, there was no significant difference in the incidence of stent thrombosis between plaque prolapse group and non-plaque prolapse group, 2.4% versus 0.9%. But if we collect more data about with plaque prolapse and more long-term follow-up, maybe we can get a more interesting data about stent thrombosis.
Very good. Let me ask Dr. Fischel. Tim, you read this piece of work and have done extensive work in stenting, stent design, cell size, and so on. What does plaque prolapse mean to you, and what does it mean to our listener?
Well, I think this was an important paper that shows us that when we implant stents in the setting of ST elevation MI, particularly when there is bulky plaque in remodeled segments, presumably with larger lipid cores, maybe with layers of organized thrombus, you can not infrequently see material inside the cylinder of the stent, that is prolapsing material, and that this is associated with larger infarcts, and it may be associated with worse outcomes. The other interesting finding to me is that there seemed to be a trend, at least, that there's a little more prolapse with more open cell stent designs, which makes sense. As the struts open, you may see more prolapse, and so that may be worth looking at and may explain some of the things we've seen in clinical trials looking at different stent designs.
What do you think the prolapse material is?
Well, I think it's by IVUS, and we've discussed this a little bit before the discussion today, but it could either be organized thrombus material, layers of sort of rubbery thrombus that's formed prior to the very fresh thrombus that brought in the patient with the elevation MI. And it could also be lipid core soft atheromatous debris in these large remodeled areas, these bulky lipid-laden plaques after they rupture the fibrous cap. You have some of this softer lipid-filled material. And all of this stuff is bad. It's very thrombogenic. And so I think his finding that there may be a trend, for example, toward greater stent thrombosis in the first 30 days is worth following. Whether there are clinical implications about what to do with it if you see it is, speculative at this point. Whether you put them on more 2B3 inhibitors, maybe if you see it really badly prolapsing, you put a second short stent over the prolapse site. These are questions that we can't answer from this paper.
Well, thank you very much. This is quite an informative discussion. Dr. Hong, I want to thank you very much, and Dr. Fischel. I think we've covered a really important piece of new observation for imaging in cardiovascular medicine.
Thank you, Dr.
Thank you.
Thank you.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.